back to Practically Pediatrics. I'm Dr. Mariana Skander. Today we're going to talk about what you should have in your medicine cabinet if you are a parent. So there are a lot of things that I usually recommend to my patients. I'm going to be going over a few products that I personally recommend to my patients. I want to let you know that I have no endorsements, no sponsorships to any of these products or their companies. I'm not getting paid by anyone. This is just my personal recommendation from my experience over time. If you don't want to use any of this stuff, don't worry about it. Do what's right for your baby and what you're comfortable with. Okay, so first we're going to start with creams. You're going to need a lot of creams for your baby. Let's start with the diaper rash creams. With diaper rash cream, I like Desitin or butt paste. And the reason why I like one of these two is because it has the highest zinc oxide percentage. That says, if you can't see it, 40% zinc, which is the highest zinc content that I have found on the market. Zinc oxide is what's actually soothing the diaper rash. Other products will have about 14%, 10%. Sometimes it's mixed in with petroleum jelly, which is fine. Sometimes that's all you need. But if you want to really knock out a diaper rash, max strength Desitin butt paste. You are going to put on a really thick layer. Be very generous, okay? Don't get stingy. You're going to put it on that booty like you're icing a cake. If you can see skin, you're not putting enough, all right? Thick, thick barrier layer, and that will help soothe that diaper rash a lot quicker. Another cream that I talk about literally on a daily basis for one reason or another is hydrocortisone cream. So this is over the counter under cortisone 10, but it's actually hydrocortisone 1%. Hydrocortisone cream is a must-have because it's going to knock out any time your baby's skin is red, itchy, or irritated. So that is anywhere from a really irritated diaper rash, insect bite, mild eczema even. And the way to use this is twice a day to the affected area, no more than 7 days at a time. But contact your doctor because your doctor should know that you're using a steroid cream and they can monitor you as you're using it. The last cream I'm going to talk about is an antibiotic ointment. Again, this is a generic. Over the counter, you'll find Polysporin, Neosporin. This is for especially those toddlers or crawlers that are going to bump into things and get superficial cuts and abrasions. Again, if that's the case, please call your doctor first, but usually they will recommend putting a little bit of an antibiotic ointment on that open skin to protect it from further infection. Again, you're gonna use twice a day to the affected area for about 7 days. All right, let's talk about fevers. Your child maybe will not, but will likely usually get a low-grade fever sometime in the first year for one reason or another. Before 6 months of age, if your child has a fever, you're going to use Tylenol. Tylenol and acetaminophen is the same medication. So acetaminophen is the generic. I have here children's Tylenol. Over the counter, you're also going to find infant Tylenol. That is just a marketing ploy. It is literally the same medication and the same strength. It's probably a different consistency or a different flavor for infants, but is literally the same medication. So buy whatever is cheaper. Call your doctor to get the dose of any fever medication because we can dose it by weight. On the back of the box, you're going to find a general guideline for weight, but if you have a bigger child, you might need a little bit more. If you have a smaller child, you might need a little bit less. So call your doctor definitely if your child has a fever, and your doctor will be able to calculate the right dose per weight for your babies. Suppositories. So acetaminophen comes over the counter in a suppository form. This is if your child is not tolerating the medication or is spitting it up or is having fever from like a stomach virus and they can't hold anything down. We can dose a suppository for you if you're comfortable doing that. Great. After 6 months, that's when you can start Motrin. or Advil. Motrin, Advil, and ibuprofen is all the same medication. Ibuprofen is the generic. Again, call your doctor so we can dose by weight. Motrin does come in 2 different strengths over the counter, so you do have to be very careful which one you have. You can use either one for any age, but you have to call your doctor so we can dose it correctly for the strength. So be very careful when you call your doctor. Let them know if you have the concentrated infant Motrin or the children's Motrin so we can help you out with that. Now for fevers, obviously you are going to need a thermometer, okay? So with this type of thermometer, you can just place it right on the forehead. I don't mess with forehead. Listen, you got to put this into an orifice. Now this one is for the ear. However, a true fever is 100.4 or more, and the way to accurately gauge a fever is rectally is the most accurate. So put it up there in the rectum. If you're not comfortable doing that, you really need to put it either in the ear to get an accurate measurement, or if your child is older, you can put it under the tongue. Don't even mess with, you know, superficial forehead swipey things or sticker thermometers. It's going to underreport the fever by half a point to a full point. And especially if your infant does have a fever, we really need to accurately assess what that number is so we can further guide treatment either way. Okay, so a good thermometer in an orifice. All right, let's go to tummy trouble in infants. All right, so we have gas drops for colic. Where's my camera? There it is. We can go, I used to use this. This is Simethicon, which is also under the name Mylicon over the counter. Or if you want something more natural and organic, there is, this is reading upside down, gripe water. Both are good for colic and gas and just abdominal distension, irritation. And just follow the directions on the box for this. I used to use Simethicon for my kids, but both are very effective. Let's now talk about, this stuff. So in the first year of life, your baby will most likely get the sniffles. If not, you're very lucky. But if they do, we can't prescribe anything for cough cold until they are 4 years or older. So all those over-the-counter cough cold medications are usually 4 years and above. So what do you do in the first 4 years of life for colds? This is what we do. Number 1, invest in a very good humidifier. I have the Honeywell germ-free humidifier. It's not a cutesy one. It's about this big. It's huge. And I crank that baby up to max. We let it run all night when our kids have colds right next to their bed. And what the humidifier does is what it sounds like. It's humidifying the air so it can keep those secretions nice and loose, especially in the nose, so the nose isn't getting blocked up and they can breathe easily while they're sleeping. And, you know, dry air will usually cause more irritation in the upper airway, more of a cough. So a good humidifier will at least let them sleep a little bit more comfortably. Also, I like a good chest rub. For older kids, you can use the Vicks Vapor Rub, but for infants, Zarbee's makes a eucalyptus-based chest rub, which is really good to keep those airways open. It's a lot less potent than Vapor Rub, so this is good for infants. A good chest rub to keep that nose open. And Zarbee's also makes, for 2 months and above, make sure you read the label really carefully because they make a 2-month and above cough and mucus homeopathic solution, and then there's also a 12-month and above one. But this is agave based, and I think there's like ivy extract in it, so it just helps temporarily clear that mucus up, keep your baby a little comfortable. And then of course we always talk about saline and suction. So saline is really good for clearing out that nasal airway. Saline is just salt water, so it just helps dissolve out that mucus, thin it out so you're able to suck it out a lot easier. And so what you're gonna do is use a suction like this. This is the Naspira, but also there's Nosefrida, which is a popular one. So what you're gonna do is put the bulb in your kid's nose, and you're gonna suck the snot out with your mouth, with this end. There is a net that's gonna catch the snot, so you shouldn't be eating it. I hope you don't eat it. Oh, gross. I never used this because I was too chicken to use it, but parents that do use it say it is very, very effective. It's better than the bulb suction you get from the hospital. This is gonna be a lot more effective in getting more mucus out and more gentle actually on your baby. Not gentle for you, it's gonna be probably traumatizing, but your baby will be happy. Okay, so that is cough, cold stuff. The last thing I wanna do is kind of miscellaneous stuff. If your baby is breastfed only, mom should supplement the baby with vitamin D drops. Even if mom is taking her prenatal vitamins, which she should, the vitamin D doesn't really come out in the breast milk very well. We get vitamin D from the sun, so babies aren't really out all day in the sun, you know, sunbathing nude. So their vitamin D levels can drop. And vitamin D is especially important for their calcium levels and their immune system. So you can get this over the counter. As long as you're exclusively breastfeeding, we should supplement with the baby with vitamin D. And then the next miscellaneous I have are cleaning your baby's ears with the right cotton swabs. These are called safety swabs. These are not called Q-tips, so you're not going to find them in the adult Q-tip section. These are going to be in the baby section, and they're very safe for the ear of a baby. So only this kind of tip, this thinner tip, is going to go into the opening of the ear canal, and this fatter area is going to protect you from not being able to put it too deep so as to damage the eardrum. So these are really great for cleaning your baby's ears. The last thing is pediatric electrolyte solution, or Pedialyte. We're gonna recommend this when your baby is not tolerating milk or formula or even breast milk sometimes. If they have a stomach virus, we usually like to put them on 24 hours of clear fluids. Ask your doctor first if that is the case. You can give as much as you want. This will usually replace formula. So you can give just as much as you would give formula or milk or anything else. We want to give the bowel some rest, so this is really easy to digest. It's basically water with electrolytes in it. We don't recommend Gatorade for babies. There's a really high sugar content in Gatorade, so it's going to be Pedialyte at least for the first couple of years. It's important to call your doctor before you're going to use any of these products, just to make sure it is safe for your particular baby. Again, your doctor might recommend other products, and that's perfectly fine. Just do whatever you feel comfortable with or whatever your baby is responding well to. And that's it. That's what you should ask for in your baby registry. That's at least what's in my medicine cabinet. I hope that helped. I'll see you soon. Bye.